An AP or an annual physical examination is a series of routine tests performed in a primary care clinic to check one's overall health status.
Siyempre, ang importance ng APE is mas-screen talaga kayo for possible detection ng early diseases. And siyempre, early detection would lead to a more successful and proper management.
As we get older, many aspects of our health change. This is why we need to have ourselves checked every year to make sure everything is functioning as they should. Join me as we walk you through the process of an annual physical exam. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk. The annual physical exam is a great way to maintain your health. Through this, people are more informed on what possible health conditions they may have in their body. I'm joined today by Dr. Reynaldo R. Mariano. He's the President and CEO for Center for Health Services Incorporated, and he's here to tell us more about the APEs. Dr. Ray, please explain to us and to the viewers, ano ba exactly ang APE or Annual Physical Exam?
It's a series of routine tests performed in a primary care clinic to check one's overall health status. It aims to detect early diseases and illnesses before they become complicated or before symptoms do set in.
Bakit napaka-importante to detect an illness early?
There are conditions na bago maging sakit, may mga parang risk factors pa lang. Hindi pa siya sakit, hindi pa gagamutin, pero with lifestyle and diet modification, mape-prevent mo yung onset bago ka maggamot, bago ka ma-hospital o magka-sudden death.
Ang kadalasan sa mga Pilipino, magpapatingin sa doktor, magpapa-examine kapag may nararamdaman. Anong mga important benefits of an annual physical exam, Dr. Ray?
First is you develop a baseline for chronic disease onset. For example, fasting blood sugar. Madidetect mo na siya kung papunta na siyang diabetes, di ba? Blood pressure, ma-check mo siya kung pauwi na siya ng hypertension. Kung cholesterol screening naman, cholesterol is a risk factor for future heart disease. So kung elevated siya, dapat ma-address mo na siya. Yung triglycerides naman, pag na-check mo at elevated, they can lead to diabetes and fatty liver disease. Second important benefit is it is an opportunity for you to provide professional guidance. Medical practitioners, doctors, are the best na mag-provide ng medical advice, magbigay ng right treatment and right diagnosis.
Would you say, Dr. Ray, that an annual physical exam is also good para dun sa mga generally healthy? Okay rin bang APE para sa pag-maintain ng tamang kalusugan ng tao?
Maraming mga individuals, kala nila healthy sila kasi wala silang nararamdaman Pero maraming mga risk factors and illnesses na pag chinek mo, wala kang nararamdaman. Pero may mga abnormalities na pala, may mga health issues na. So, kung yung healthy, sabi ko nga, may baseline kang kailangan para at least ma-detect mo early. Kung wala ka namang ma-detect, wala namang perfect health talaga So, dadaan ka pa rin sa physician counseling, tuturuan ka pa rin ng mga i-assess ka pa rin kung healthy ba yung lifestyle mo. Kasi kahit naman healthy living ka, may mga risk factors na genetics and age na darating at darating yung sakit mo. Pag hindi mo inagapan ngayon, in time, magkakasakit ka rin. Titingnan yung vital signs, may section kami na titingnan yung visual acuity mo, may section on titingnan yung height and weight, and then sa laboratory, checkin yung mga blood tests. Lahat ng blood tests naman available dyan, depende sa packages na pipiliin mo, and also depende sa risk factors, sa age. May mga packages for yung mga 20s, may packages for 30s and above. And then meron din kayong mga ECG section, chest x-ray section, and then dental section para ma-check yung oral exam, and then yung doctor naman to check yung physical health mo. So lahat naman dadaanan niya, and we try to make it very efficient and convenient kasi hassle talaga pag maraming mga pasyente tapos naabala sila. So fully automated na yung aming system. We encode yung mga PE nila, mga findings, yung information, yung results through the computers, and then we send yung mga, ngayon kasi technology, paperless na system na talaga napapadala mo na yung mga results sa consultants for reading, nasasend mo yung results sa mga pasyente through SMS na lang, at saka email. So basically, napakadali na ng PA, very convenient.
When we return, we'll see how it is like to undergo an APE. So keep it here on MedTalk Health Talk. It is but natural to feel a little nervous if you're going to undergo an annual physical exam, lalong-lalo na kapag you've never had one before. I'm joined today by Dr. Sharee Chua, company doctor for CHSI, to show us how painless, efficient, and relatively easy an annual physical exam is. Hello and welcome, Dr. Sharee. Thank you for joining us here and showing us CHSI.
Welcome, no? So, yes, I will be with you as we walk through the clinic and discuss the various activities that run through the veins of this playground. Siyempre, ang importance ng APE, no, is ma-screen talaga kayo for possible detection ng early diseases. And siyempre, early detection would lead to a more successful and proper management.
Okay, early detection, proper management, that's what we want. So here, Dr. Sharee is going to show us what exactly entails an annual physical exam. So where do we start, Dr. Sharee?
So let's have your vital signs checked muna. No? So,
Okay, what's the importance of my vital signs being checked, Dr. Sharee?
well, vital signs kasi is the process of checking your one's blood pressure, heart rate, respiratory rate, and body temperature. So, yung importance kasi of checking your vital signs is that it allows your doctor kasi to assess your current state of well-being. So, eto, syempre, pag chine-check natin regularly yung vital signs natin, alam natin kung what is normal for our body. And in case merong any fluctuations or abnormalities, makakatake tayo ng immediate action. And always remember that early action leads to a more effective na management.
Early action, better management. So that's what we're going for here. Now dito, Dr. Sharee, sa blood pressure, what exactly ang natetest ng ating nurse today?
Yes,
Ano bang nakikita niya dito?
So dito, check niya kung normal ba yung BP mo or if like for example, hypertensive ka, di ba? Elevated yung BP. So dito, pag nalaman natin na hypertensive ka, at least ma-action na natin baka may additional further test na pwedeng i-recommend yung doctor sa inyo like mga ECG, no?
Pero Dr. Sharee, let's say for example, mataas ang BP ko, pagkita pa lang sa vital signs, hindi na ba magtutuloy ang aking APE?
Not necessarily, no? Depende kung how high kasi yung BP natin. If like for example, yung BP natin is more than 160 na, over 100, yung mga ganun, baka kailangan na dalhin sa ER.
Okay. So my vital signs was checked. Thank you so much for that. It was fast, painless. What's next, Dr. Sharee?
So let's proceed naman to get your anthropometric examination.
Okay, so here we are, Dr. Sharee, and to get my anthropometric measurements, which basically are what?
Height, weight, and computation of your body mass index. So,
Okay. What is the importance of knowing the body mass index or the BMI of someone, Dr. Sharee?
well, it allows your doctor kasi to gauge whether healthy proportional ba yung weight mo sa height mo. And yun din, like, syempre parang dyan malalaman natin, like, if nag-exceed ka to normal range, diba, baka mamaya overweight ka or obese, no, na pwedeng mag-lead to ito sa future chronic conditions like mga diabetes or other metabolic diseases.
So, Dr. Sharee, Nurse Camille, what are my results?
It's 26.42. So medyo nasa overweight ka.
Okay. Now, Doc Sharee, I don't feel anything. I feel great. But according to that, it says that I am overweight. How important is it na ngayon ko lang nalaman na overweight na pala ako?
Oo, kaya nga important din talaga na accurate yung pag-measure natin, no? Kasi dito natin ma-check, like yan, yung sinabi ko earlier, kung yung nag-exceed ka to a normal healthy range, like overweight or obese, it can lead kasi to chronic diseases sa future, like yun, pwede ka mag-develop ng other metabolic conditions or diabetes. And syempre, it doesn't mean naman na porket wala kang nararamdaman, healthy ka. So, ito talaga yung importance kung bakit natin ginagawa yung APE is to screen yung mga possible diseases na baka meron ka. So, here naman, we will check for your visual acuity test, no, using the Snellen eye chart. So dito, it will allow your doctor kasi to check whether meron kang any visual deficits or in need ka ba to use any prescription lenses in order for you to see properly. Cover na lang your right eye first, and then read from top to bottom kung hanggang saan yung kaya mo.
So each line signifies has a certain
Yes.
a number corresponding to the distance that I can see it
Yes,
comfortably.
yes.
Okay, so if I
right.
see the topmost, which is the biggest one, I can see that E, then it's F, P, then it's T, O, Z, then L, P, E, D, then P, E, C, F, D, and then as it goes lower, the letters become smaller and smaller, and I'm having difficulty now. So each line corresponds to a certain level in which I am comfortable seeing the letters clearly. So if I could see up to the 6th line clearly, comfortably, Dr. Sherry, what does that mean?
20/30 yung vision mo na actually pasok pa rin yan sa normal, no? But yung pinaka-clear talaga na vision is 20/20.
Okay.
And below, siguro 5 and below, ba yan, kailangan mo na ng prescription lenses.
Okay. Now that we're here in the history taking and physical exam room, how does the interview start? How does the history taking start, Dr. Venus?
Okay, so Freddie, I'm gonna ask you about your medical history, family history, personal and social history.
Okay, so what's the importance of all of these information, Dr. Sherry?
So it's parang ano kasi a health risk assessment, no? So depende sa history mo, family history. So let's say may mga strong family history ka of mga chronic diseases, cancer, or let's say heart disease, hypertension, yung doctor may, add additional tests, no?
So now I'm gonna auscultate your heart.
Okay, so this is the process where a lot of people are familiar with when the doctor checks the heart. So
Normal breathing.
what kind of information, Dr. Venus, can you assess just by listening to someone's heart?
So we're gonna know whether if you have an irregularities of your heart rhythm. So to check it, you have to do auscultation of your heart.
Okay.
And we're gonna do auscultation also at the back
For
your lungs.
the lungs. Okay.
Inhale, exhale. Again, exhale. Okay, good.
Now, what kind of
It's clear.
abnormalities would you be able to hear if there was something wrong with my lungs?
For example, if there is wheezing, so we're gonna do, probably you have an asthma, or if there's crackles or rales, then probably you have an infection, bronchitis or pneumonia.
Okay, so all of those information could only be seen with a proper and thorough physical exam. Now that we've had a good history taking and physical exam, Dr. Sherry, what is next in the APE lineup?
Laboratory tests. So let's go there for your blood extraction.
Okay, let's do that. Okay, so please explain to us, Dr. Sherry, what is next. This looks like one of the more intimidating procedures.
So you're here at the extraction area. So our medtech will get sample of your blood. So etong lab test kasi na part, it is a procedure wherein your healthcare provider gets sample of your blood, urine, body fluids, body tissue to get information about your health. No, and people talaga dapat should not be afraid of doing lab test because screening ito eh. So, syempre, ang goal ng screening or testing na yan is to syempre, malalaman natin early detection of certain diseases that would lead naman to a more effective and successful management.
Thank you so much, Dr. Sherry, for joining us and showing us the many features here and how people get their annual physical exam.
Thank you then, Dr. Freddie Gomez. No, so how was your overall experience doing an APE?
The overall experience was definitely something that was very comfortable. It was very efficient. There was hardly ever no discomfort at all. And what made it best was the amount of information that was seen. Even I didn't know that I may have had it, and the information could prevent any further complications with my health later on. And that was it. It was highly efficient, no pain at all, and it was so fast. So the annual physical exam does have a lot of benefits, and that's what we will be discussing later on after the break. So keep it here on Med Talk Health Talk. The annual physical exam is a great way to know the general state of your health. So we're still joined by Dr. Reynaldo Mariano, President and CEO of CHSI. Dr. Mariano, now we want to know kung ano ba talaga ang benefits ng annual physical exam.
Our mission is prevention. So we detect illnesses early so that they can be treated, corrected, and then yun, naibabalik namin yung patient to dun sa normal state of health. And then pag nabalik ka sa normal state of health, you can live more efficiently, you can work more productively, and then you can live life to the fullest.
One of the groups in which the APE is encouraged are the senior citizens, yung mga mas advanced in age. Why is this so, Dr. Ray?
Elderly individuals who have regular checkups and regular annual physical exams actually have lower incidence of deaths than those who do not. So sabihin, an APA can improve your lifespan. Ayun ang tsaka sa elderly kasi, they are age-related diseases, di ba? So pag mayroon kang annual physical exam, at least na-delay mo yung progression.
One of the biggest reasons kung bakit ayaw magpa-exam ang ng mga tao is takot nilang malaman. Takot silang malaman kung anong meron sila. And this becomes a hindrance for them to actually know the truth about their health. What can you say about this, Dr. Ray?
Very natural talaga, kahit sa mga companies, marami talagang ayaw magpapi kasi takot silang may ma-discover na sakit. Pero actually, marami kami mga employees or mga patients na nag-undergo ng AP na very, very thankful sila kasi kung hindi sila nagpa-PE, siguro sabi lang baka nagkaroon sila ng ganitong condition, na-hospital sila o baka nauwi pa sa mga sudden death, diba? So what we do is we educate. Meron kami mga day fora on how to explain sa mga employees, sa mga patients, yung value ng AP. Huwag silang matakot kasi mas matakot sila dun sa hindi sila magpa-PA kasi di ba nakakatakot yung magkasakit. And consider your clinic and your doctor as your partners in your journey towards good health.
What advice can you give the viewers in order to encourage them to schedule an APE?
Sinasabi namin na if you really love your family, if you love your work, you love yourself, maging more productive, more efficient, gusto mong makatipid para meron kang gagastusin para sa family. Pero kung nagkasakit ka, paano na? Diba? Ang laking cost burden na magkasakit. Mahal ang mga gamot, mahal magpa-hospital. So, mababawasan yung income para sa family mo. And for your work naman, syempre, di ba, hindi ka na ganun ka-productive sa work, magsasuffer naman.
Paano naman ngayon namin ma-maintain, Dr. Ray, ang aming magandang kalusugan kahit na nasa labas na kami ng clinic?
With regular monitoring, regular screening, ma-check ng doctor kung na-maintain mo yung condition mo, nag-worsen, so magagamot agad. And maraming life changes dun sa mga nagpa-PE na may na-discover silang mga deficiencies or mga abnormalities. So nagiging mas aware na sila dun sa health nila. So they engage in exercise, being active. Yung kinakain nila, siyempre, pinibilang na nila ngayon yung calories nila and then chinecheck nila kung tama ba yung kinakain nila.
With that, I'd like to thank you so much, Dr. Ray Mariano, for sharing your expertise and insights, especially when it comes to the benefits of the annual physical exam.
Thank you
so much.
Thank you.
Your annual physical exam is your personalized healthcare. It's a good way for you to understand your body and your health, and hopefully leads to a better you. I'm Dr. Freddy Gomez. Thank you for joining us here on Med Talk Health Talk.